It's all around the news these days. It's basically you can't turn on a news outlet, you can't look at something on social media, you can't open a newspaper without seeing more information about COVID-19 and all of the problems that people are now seeing with it as case numbers go up again. And unfortunately, certain towns and states and countries are imposing new restrictions all over the world as we do see these case numbers, unfortunately go up. But we are about 6 months into this pandemic, 6-7 months, and I figured this was kind of a good benchmark to rehash a little bit about what we know as far as COVID-19 and your pets are concerned, as well as kind of go over any new information that might be out there, as we as veterinarians are starting to get more questions again, especially here in Pennsylvania. We just had the case of the cat that tested positive for COVID-19, so figured this would be a good time to kind of go over everything, answer some of the basic questions to make sure that you, the pet owner, have the most up-to-date and accurate information. So come along on a drive with me as we enjoy the beautiful countryside and discuss COVID-19 and your pets. Thanks for coming along with this little drive as we talk a little COVID in your pets and in the world at large. And so, I think the best way to kind of handle this would be in sort of a Q&A format. So we're going to kind of look at things from basic questions that are usually asked of us as veterinarians as we move forward, and go through this pandemic and learn more and more about the virus and how it potentially can affect certain animals and whether those animals can transmit the virus, things of that nature. So the first question that always comes up is, well, wait a minute, I've heard about coronavirus in dogs and coronavirus in cats that can cause FIP, coronavirus in horses. Isn't this the same type of coronavirus that we've seen in animals all along? After all, it came from an animal, didn't it, when it jumped to humans, and it's just new in humans. That's not the case here. When we talk about COVID-19, we're talking basically about an illness that is caused by a very specific strain of coronavirus or type of coronavirus, and that is known as the SARS-CoV-2 virus. It is not the same coronavirus that has been endemic in the cat population or endemic in the dog or horse population for decades, and that usually causes, in most cases, some mild gastrointestinal signs. In cats, of course, coronas in certain cases can mutate and become FIP. But again, when we are talking about testing, when we are talking about treating or being concerned about coronavirus when it comes to the pandemic, we really are talking about just this SARS-CoV-2 strain, nothing else. So that's really important to remember when we talk about testing and treatment and species and infected animals and things of that nature. And it's important to always have that stuff kind of delineated and separated out. The next question that comes up is, well, we know from reading in newspaper articles and seeing on social media, certain animals can become infected with it, so which ones are most likely to become infected? And basically, what they found through research is that the top 3 types of animals that normally are going to be infected with COVID are minks, ferrets, anything in that kind of family, and cats. And the reason for that is that these animals all share basically a similar type of what we call ACE receptor on the respiratory tissues and lung tissues and things like that. And it's this ACE receptor that humans have as well, which makes it so easy for coronavirus to affect us. that the virus attaches to and then replicates, invades the cell, causes disease, all of those things. So those are the top 3 species that normally we see or are concerned about, I should say, with potentially coming down with COVID. Again, you might have heard about the Bronx Zoo case of all of the big cats there getting infected. You know, we do see it in dogs, not really that frequently, and I guess I should say really in all of these species, we really do not see a large number of cases. If we did, this would be a totally different conversation. So we are seeing a sporadic case pop up here and there of animals, you know, that have been tested and found to be positive. In cats, minks, the reason we kind of bring that up is because there's a lot of mink farming, and so you deal with a much more closer cluster of animals together, and that can, you know, in any case, lead to potential disease spread. But in dogs, we do see it, but they tend not to have the same number of ACE receptors that some of the other species and that we do, so it doesn't really tend to infect them quite as much. So that's important to remember. Next question that usually comes up is, well, if my pet is infected, what kind of symptoms would I see? What kind of things would my vet look for to make me think that potentially my pet has COVID? Well, I'm going to answer that kind of in 2 parts. The first part is, if there was no real known exposure to COVID, so if nobody in the household had COVID-19, you know, or was exposed to COVID-19, it's not going to be really high on our radar to look for, because in most cases with animals, it causes some very mild upper respiratory signs, almost like what it causes in, you know, 80% of the population, or whatever the current percentage is for the humans now, where, you know, your pet may seem down for a couple of days, they may feel a little blah, they may have some respiratory signs such as, you know, a little bit of sneezing, a little bit of coughing, a little bit of discharge from their nose, and then they get better in a couple of days. So it would be something that we really wouldn't even think to necessarily test for unless there was a potential known exposure risk for that pet, or they were for some reason getting worse, more severely ill with symptoms and signs. And again, that's something that very rarely happens. So keep all of that stuff in mind. Now, that kind of, you know, dovetails into the next question that's very often asked, and that is, well, can I get my pet tested? You know, if I really suspect he or she has it, is there a test available for pets, you know, and where can I get it? The answer to that question is yes, you can get your pet tested, but only really if your veterinarian strongly suspects that that's a potential issue in your pet. It is not something that is just normally added on to any testing protocol. It's not where normally you can just walk into your vet's office and say, I want my pet tested for COVID. In most cases, it's not going to be done. It really has to be done under a high level of suspicion. And the real reason for that is kind of twofold. Is, again, we are not seeing large numbers of cases in animals. And 2, we do want to save these testing supplies and reagents to be able to test you know, the humans in the population that are far more susceptible right now to it. So really, you're probably only going to have your pet tested if they really do start really showing signs of COVID and there's a potential known exposure, and maybe they have signs of an upper respiratory infection, but they're not really responding to treatment the way we would think. So yes, you can get them tested, but it's not something that's going to be mainstream. We don't expect it to go mainstream anytime soon. We still can't get widespread testing for humans down with, you know, with the supplies that we need. So unless something happens where we're seeing a lot more animals potentially infected with COVID, you're not going to see any kind of major uptick in testing with animals. That's just something that is not going to happen. So, you know, that's kind of the answer, is you can get them tested. Probably not going to happen unless there's a high level of suspicion. But now, here comes the real, and I kind of touched on this, here comes the real questions that are always asked when it comes to this, and what a lot of people read about is, can I give my pet COVID? And the answer to that question is yes. We have seen cases where we now know that humans that have been heavily infected with COVID, having a really severe infection and have had very close contact with their pets, can transmit the disease to their dog or cat. Originally, we weren't sure if it was just a situation where they would just have the virus kind of in their tissues, but it wasn't really infecting them. That thinking has changed now, and we have actually shown that basically, yes, in, you know, perfect conditions, again, with a lot of close contact with you and your pet, and you're shedding a lot of virus, you can, you know, infect your pet. And that is why really the recommendations of the AVMA and the CDC come down to, if you are infected and found to be positive with COVID and you do have a dog or cat, it's really best to try to, let somebody else take care of that animal if possible. That's really what we want you to do. We want you to be able to, focus first of all on getting better if you are symptomatic with COVID. And obviously nobody wants to walk their dog or scoop their cat's litter box if, they are really feeling down and sick. But the other thing to remember too is we want to try to avoid that exposure as much as possible to your pet. And so just having somebody else take care of them, if that's possible, is really the way to go. Now, if you can't do that, we understand that. Just try to limit the real close face contact with your pet, things like that, and just practice really good hygiene measures. All of things in that realm, and you'll probably be fine, and your pets will be fine as well. Now, the other question that always pops up along that is, let's reverse the scenario. And can animals, or your pet or your dog or your cat, can they give COVID to you? The science and the answer right now is there has been no definitive scientific evidence or case that has been shown where our human has directly contracted COVID and gotten sick from a dog or a cat or a horse or a pet or whatever. Now, I know everybody's going to jump up and say, well, wait a minute, it came from bats, so it has to be able to come from animals to humans. Yes, but we also think there was an intermediate species there that might have allowed the virus to mutate a little bit more to make it much more infectious to humans. All of that stuff is still being researched. There's a lot more research going on right now in the realm of COVID in animals, but to answer the question, there is no definitive scientific evidence right now that shows that your dog or cat can give you COVID. Even if they test positive and potentially have signs of it, there is no evidence that they are going to infect you or can infect you. So please do not be scared of animals. Do not think that you have to all of a sudden get rid of the stray cat population, because that could be a major source of infection. You really don't have to worry about this. And if something changes, we certainly, as veterinarians, will be the first to get up there and let everybody know this. But so far, the virus has stayed pretty stable and hasn't mutated that much and hasn't really caused that much of a problem in animals. So, or I should say, in transmitting from animals to humans. So kind of keep that in mind. There really is no risk there. Can they potentially spread it to other animals of the same species? We have, and we believe that can happen in animals such as like mink and potentially cats if the conditions are perfect, but it's not something that's very easily done. So again, you don't have to worry about this virus spreading like wildfire through wild cat populations or animal populations, things of that nature. It really does not seem to be that easily transmitted from animal to animal. The big concern really is human to human right now, when you look at all the research that's out there and everything that's going on. And again, if that changes, we as veterinarians will be the first one to jump on and certainly tell you that. So keep all of that stuff in mind. So what other kind of questions do we get asked? One big one that of course always pops up again is, well, is there a vaccine? We hear about this, Operation Warp Speed and all these companies that are trying to produce human COVID vaccines. And well, is there anything coming on in the animal realm for that? Is there any animals that, or companies that are producing vaccines for animals? And the answer is yes. There is one company out in the Midwest that specializes in a bunch of different types of vaccines for animals that is working on a COVID vaccine for pets. Specifically, they're looking at cats and potentially maybe ferrets and mink, again, since those seem to be the top 3 that are infected. They have made some headway on it, but unless more money comes into it, we really don't see it going mainstream anytime soon. Now, there might be limited doses that are produced, maybe for mink farms or catteries, things of that nature, shelters perhaps, if it really does become a problem. But personally, I don't really think you're going to see a vaccine on the market anytime soon unless a lot more money is pumped into it. And, unfortunately, while we don't like to think of money being the driver behind these things, the truth of the matter is it really does cost millions of dollars to get a vaccine, from development stage through all of the safety trials, through all of the other testing that the FDA requires to make sure that it is protective to a certain degree, and then to go out and market it. So there has to be some money in it, and there has to be a return on investment that's potentially there for the company that's making it as well. As I said before, there's just not enough information out there to say that, COVID is going to be a major problem in animals, so therefore we should really focus on making a vaccine. Will that happen? Potentially. Where maybe once all the human vaccine is done, and then some of these companies try to transfer over and say, okay, We're going to make it for animals if people want it, but it's not going to be a kind of a core vaccine. Stay tuned on that, but right now, really, there is no vaccine for pets, and we don't expect one at least until the middle to later of 2021, if at all it's ever going to actually be produced. Another question that comes up, and this kind of deals more with the veterinary profession itself and kind of complaints that we're getting a little bit from clients and things of that nature, is COVID-19 has really changed the way veterinary medicine is practiced in a lot of ways, especially on the small animal realm. A lot of people are still doing curbside check-in, or where, the hospital itself is kind of closed, the animal comes in, is looked at, and then the, owner is talked to on the phone. And all of this is not necessarily the ideal way that we want to do it as veterinarians either. But in order to protect our staffs, in order to protect ourselves, in order to protect other clients, we do have to do it this way to make sure that we can stay open for business. So that we don't come down with COVID or a member of our staff, and then that shuts the entire hospital down for 2 weeks or whatever, if somebody has to recover or you're going through the quarantine period. So please, all of us realize that this is a strain. All of us realize that, this is not the ideal way that we want to do things. Unfortunately, there really is no other option right now. So we're just, once again asking everybody, please just have a little bit of patience with us. We know it's difficult, we know it's not ideal, but we're trying to do the absolute best we can for you and your pet. And it's going to mean that wait times are going to be a little bit longer. It does mean that it may be harder to get an appointment for basic things. The veterinary profession is stretched very thin right now because of COVID and some other matters. And that just kind of made things that much more critical in trying to get animals seen. And we do realize that because a lot of people were home, with COVID, they're either on quarantine or, they're working from home, they are noticing more problems with their animals right now. Potentially they're, or they're getting a new animal and they have questions about it. So we're trying to do the best we can. There are telehealth options out there. Please take advantage of those telehealth options if that's something that you think of, with your vet, and some vets already have that out there, because they can answer those questions very easily. Not every animal necessarily needs to be seen for every little problem. That is something that, sometimes telehealth and just kind of like an online chat with your vet can answer some basic questions. So again, just try to be a little bit patient with us. We're trying to do the best that we can, and we're trying to get things seen and taken care of as quickly as we absolutely can. But there are going to be increased wait times and increased time to be able to get an appointment, and the curbside check-in thing is probably going to be in effect at a lot of hospitals until a vaccine is available. Unfortunately, that's just the reality of the situation. So the final question that we're going to tackle very briefly is one that doesn't really have to deal with dogs and cats, but of course, there's people that own horses, there's people that work on farms. Does it affect farm animals? And there are certain coronaviruses out there, that affect cows, that affect horses. But as we said at the beginning, we're talking specifically about COVID-19 virus, the SARS-CoV-2. So the basic answer is there really has been no evidence of infections happening in horses, cows, sheep, pigs, goats that I'm aware of. I have heard one story of a racehorse that had a very severe pneumonia that was treated for a long time, and supposedly the connections of that horse said that they were suffering from COVID-19. I'm not sure if that's exactly correct. I'm trying to research that one a little bit more, but there really haven't been any other, mentions of these types of infections in farm animals. So you really don't have too much to worry about there. Again, if anything changes, we will certainly be the first one to jump on and tell you, but we're not noticing it anywhere. So I don't think it's anything for you guys to have to worry about. Again, practicing good hygiene, making sure everything stays clean and disinfected is really the best thing that you possibly can do, in those types of situations when you have concerns. Just practicing good hygiene is what makes everything kind of click. So those are kind of all the major things that we wanted to talk about when it comes to COVID. So, let's try to bring it all back together to give everybody what we like to call Doc's 5 takeaways from this little drive through the countryside that we've enjoyed. So let's take a look at the 5 things that I want to make sure everybody kind of remembers and keeps in the back of their head when it comes to COVID. First, as we talked about in the beginning, COVID-19 is the syndrome caused by the new novel coronavirus SARS-CoV-2. It is not related to any of the other coronaviruses that animals normally have or normally can get. So keep that in mind. Number 2, minks, ferrets, and cats apparently are the top 3 species that seem to be easily or more easily infected with COVID-19. But keep in mind, again, when we say easily infected, we're also talking about very low percentage numbers of cases here. This is not something that is spreading very quickly through a lot of these populations. 3, yes, your pet can be tested for it, but more than likely it's not going to be. And there is no widespread testing that is available that we are aware of anyway right now. So, just keep that in mind. If you ask your vet, can my pet be tested for COVID? The answer may be no. It's going to depend on the symptoms that they're kind of showing. And it's only if your veterinarian recommends it, and there's other, paperwork that usually has to be filled out if you are testing an animal for COVID. Number 4, widespread vaccination of pets for COVID is probably not going to be happening anytime soon. That is something that is probably a couple of years away if we ever do see it. There is only that one company that's working on a vaccine right now for cats and potentially ferrets and mink. We don't know if it's even going to be effective at this point. So don't be holding your breath. Don't think that, there's going to be a vaccine on the horizon coming out for your pets. And it's probably really not necessary for your pets at this point anyway. And finally, 5, please try to remember to have a little bit of patience with us in the veterinary community. We are trying to do the absolute best we can for you and your pets, and we want to make sure that we give them the same level of care that we always can, but that is going to mean that our procedures are going to have to change a little bit, probably for the foreseeable future, until a widespread human vaccine gets out there. And once that happens and more people are vaccinated, things might return to a little bit more of a normal. Fortunately, right now, we're just going to have to kind of deal with the new normal that's out there with curbside check-in and offices closed for most appointments, in-person appointments anyway. But do consider taking advantage of any telehealth opportunities that your veterinarian may offer. So those are the 5 takeaways, Doc's 5 takeaways. I hope that everybody found this drive through the kind of early evening informative, and gave you some information to know about COVID, the most up-to-date information. And of course, if you're always looking for some more information on it, always go to reputable sources. So the Pennsylvania Veterinary Medical Association, pavma.org, again, pavma.org is a great resource. We have a whole section up there just about COVID. The American Veterinary Medical Association, avma.org, has some great information on COVID. And of course, the CDC website, cdc.gov, has tons and tons of information on COVID in regards to both humans and pets. So those are some great resources. If you do have more questions, remember, your veterinarian really is the one that has the up-to-date information and the most trusted and accurate information when it comes to COVID as well. So I am Dr. Langlois. I hope you've enjoyed the little drive with me. If you do have any further questions, certainly feel free to drop me a line at drivingwithdoc@gmail.com. Again, drivingwithdoc@gmail.com. If it involves COVID, I'll try to answer it. If it involves any other subject that maybe you would like to hear me talk about as we take drives through the beautiful countryside and small towns here in Pennsylvania. So hope everybody enjoyed it. Hope everybody is staying safe. And always remember, much as we may not want to do it, wear your mask. It does make a difference, despite what some of the naysayers say. It really is making a difference. Stay safe, use some common sense, and let's get through all of this together. So we will see you next time, driving with Doc.